invitation of this event, this International Journal of Social Determinants of Health and Health Services. Thank you all very much for attending this meeting, either here or, you know, or online. That unfortunately, I think it's not possible today, but watching it in a recorded version. I want to speak briefly about some of the ideas that are behind the main points that the journal is trying to cover. We live in disturbing times, times of profound change. Global developments of the last decades, such as the reported drop in life expectancy before and after COVID-19 in some rich countries, new pandemics like obesity, diabetes, all sorts of addictions, and the multiple effects generated by several wars and the climate and ecological crisis, mostly in low-income countries, but also in middle and high-income countries. All of these have increased health inequities at the local, national, and global levels. Today, I think there is an urgent need to respond to these global challenges that represent existential threats to global health and health equity. Yet these problems do not exist naturally. Science is crystal clear. They are human-made by mainly political, economic arrangements, social, cultural contexts, political choices. The examples of policies and developments that are making the goal of achieving health for all in a livable planet an increasingly elusive need include many. For example, the increasing financialization of the economy, the concentration of private economic power, and the growth of neoliberalism, austerity policies, the global expansion of work precarization, the rapid and worrisome unequal changes in the techno-scientific revolution, the growing emergence of authoritarianism, and also population surveillance and control. Yet it is important to not only to see how and why this is occurring, but also to identify who is responsible. 5 years ago, at the COP24 in Poland, a 15-year-old Swedish adolescent, Greta Thunberg, said, quote, "Our civilization is being sacrificed for the opportunity of a very small number of people to continue making enormous amounts of money. Our biosphere is being sacrificed so that rich people in countries like mine, Sweden, can live in luxury. It is the sufferings of the many which pay for the luxuries of the few. We have not come here to beg world leaders to care. You have ignored us in the past, and you will ignore us again. We have run out of excuses, and we are running out of time. We have come here to let you know the change is coming, whether you like it or not. The real power belongs to the people," end quote. Well, that happens 5 years ago. This Monday, just 4 days ago, in the European Union Parliament, there have been a very important plenary sessions on the growth. In the session Limits to Growth, where do we stand and where do we go from here? Professor and researcher Jason Hickel said, quote, "The constant hunt for more growth in the global north relies on a constant net appropriation of materials, energy, land, and labor from the territories of the global south. This drains poorer countries of resources that are necessary for developments. It colonizes their lands. It produces global inequality. And it means that the social and ecological costs of growth are offshored or externalized onto vulnerable communities. Our economic system fails in both ecological and social terms. Our economic system is fundamentally undemocratic. Our productive capacities are controlled by capital and mobilized around what is profitable to capital rather than what is necessary for human well-being and ecology. We can and we must do better. We cannot just ignore science. We cannot just ignore injustice. We need solutions that deal with the ecological crisis and the social crisis together," end quote. Well, these unjust systems continue to harm life and health, not only for humans, but also for the whole planet. Looking at crises and solutions, it is important to assess the role played by scientific journals in displaying the most important issues linked to research and action to achieve health equity and real sustainability. It is our view that not enough attention is devoted to the ecosocial factors that lead to ill health, and that when it is done, the negative health consequences of inequality are often documented, but not enough attention is paid to explaining its political and economic causes and to the potential policies, interventions, and evaluations that reduce social inequality. Since the publication of its first issue in 1971, the International Journal of Health Services has made a remarkable effort to understand global health inequities, highlighting the root causes and analyzing social and health policies, as well as offering a critical view of their underlying historical, political, and environmental factors. Carlos Muntaner and I are delighted and honored to have taken the role as new co-editors-in-chief of a new journal named International Journal of Social Determinants of Health and Health Services. And although there are many ways to understand the expression social determinants of health, by this term we mean to focus on these key political, economic, cultural, and ecological determinants, the causes of the causes of the causes, as several authors, including us ourselves, have pointed out, the determinants that are driving the fate of humankind. Today's meeting aims not only to introduce, not the journal only, but also to have the opportunity to discuss with very notable speakers from across the world many of the issues I just mentioned. The aim of the meeting cannot be, of course, to get final solutions, but to promote debate, to engage in a necessarily lively discussion, searching for ideas and proposals, helping to face the many challenges that humanity is facing today. We'll have 4 sessions with debates, as well as some videos, posters, and of course the opportunity for many of us to see each other face to face, have the chance to chat, exchange ideas, proposals, worries, and also hopes. We are very grateful to all the institutions that have made it possible to organize and support this event. My universities, University Pompeu Fabra, Hopkins University, SAGE, the publisher of the journal. Many thanks to Josep Lluís Martí, the professor of the Department of Law of the UPF and Commissioner for the Planetary Wellbeing Project, Laia de Nadal, the new elected UPF rector, and also to our editor of SAGE, Melinda Keramat, Keisha Pollack-Porter, the chair of the Department of Health Policy and Management at the Johns Hopkins Bloomberg School of Public Health, and of course, last but not least, the wonderful team in the Hopkins UPF Public Policy Center that has prepared this event. So I have to thank Goody Singh for her invaluable help, but also Ferran Muntaner, Lucinda Cash-Gibson, Mariana Gutiérrez, Eliana Martínez, Ángela María Londoño, Josep María Caroz, Ornella Moreno, Julián Martínez, Montse López, Carola Domènech, Laila Vivas, and very especially to Ave Ribbons, who is over there, I think. This big applause goes for you, for all of you.